Hi, my name is Peter Steinberg, and I'm a urologist at Beth Israel Deaconess Medical Center in Boston. Today I'm going to talk to you about having a vasectomy. A vasectomy is a permanent form of male sterilization that will make it impossible for you to father children after having this procedure. This is a procedure we usually perform in an office setting, though somewhere around 10 to 20% of people need this done in an operating room under general anesthesia. This is something we do in both our office in Boston and in Chestnut Hill, and when required in the operating room at Beth Israel Deaconess Medical Center in Boston. The procedure involves the permanent disruption of a tube called the vas deferens that carries sperm from the testicle to where it can be ejaculated out of your body. And the procedure involves permanently disrupting this so sperm can no longer get out into your ejaculate. This is done just above the testicle within the scrotum through a very small incision on each side of the scrotum. The procedure in the office is usually done with a combination of a local anesthetic injected into the vas above the testicle, and also with an oral dose of a relaxing medication called triazolam that we have you take ahead of time. Obviously, if this is done in the operating room, it's done with a combination of general anesthesia and local anesthesia in the surgical site. During the procedure, we'll ask you to bring some headphones to either listen to music or a podcast, and we'll often play some relaxing music in the procedure room as well. And again, this takes about 20 to 30 minutes. During the procedure, you're going to be lying flat on your back. We'll clean your penis and testicles up with an antiseptic soap. We'll locate the vas on each side. Feels like a guitar string. And then we'll numb it up with that local anesthetic. That is painful. It feels like you're getting kicked in the balls and stung by a bee at the same time. But usually the vas gets numb within about 1 to 2 minutes and allows us to start the procedure. The way I do this is using something called the no scalpel technique, where a small hole is made with a sharp pointed instrument into each side of the scrotum. The vas is delivered and then divided. The vas feels kind of like a guitar string, and it's brought up and out of the scrotum in order to divide it. There are many different ways to successfully divide the vas, and the way I do this is using a small cautery device. I cut the vas in half. I cauterize one of the ends of the vas, sometimes both, depending on some specifics of your anatomy, and then we'll separate both ends of the vas permanently with a permanent surgical metal clip. And again, all of this is done to keep the ends from growing back together and rendering you permanently infertile. At the end of the procedure, we can usually close the skin with dissolvable superglue that falls off within about a week. If there is a lot of bleeding from the skin edges, we'll use a dissolvable stitch that also falls out within about a week. We'll put a bunch of gauze on your scrotum, some supportive underwear, give you an ice pack, and send you home to recover. We do recommend that someone drives you home, especially if you take that medication, triazolam. You'll be impaired and won't be able to drive. And if the procedure is done in the operating room, you need to have a responsible adult take you home. When the procedure is done in the office, it's acceptable to take a ride share like an Uber or a Lyft home if you don't have someone who can give you a ride. We tend to do these in the afternoon every day of the week except for Wednesday, again, either in our Boston or Chestnut Hill office. Most people prefer to do this on a Friday, though we can certainly work around your schedule to make it convenient. If you have the procedure on Friday, unless you have a heavy manual labor or strenuous job, usually you can be back to work by Monday, although sometimes some folks need to take it easy for several days afterwards. And with a physical or manual labor job, we tend to recommend a minimum of 7 and sometimes 10 to 14 days off of work during the recovery. There are some short-term and some long-term issues you need to understand about your recovery. In the short run, the biggest issue we run into is bleeding, bruising, and swelling of the scrotum. So at the time of the procedure, we do a lot of things to keep there from being bleeding in the scrotum. And the things you can do to help that are wear supportive underwear, ice your scrotum afterwards, and refrain from heavy lifting and strenuous physical activity for 7 to 10 days post-procedure. Ice is really helpful, and something like frozen peas or frozen corn that can deform and fit over the scrotum is usually really helpful. Infections are quite uncommon, probably under 1% of the time, and if these do happen, which again is unusual, it can successfully often be treated with oral antibiotics. People always ask, how uncomfortable is this going to be afterwards? Obviously, everyone has a different pain threshold. What I can tell you is most people just need Tylenol or Advil to manage their pain, and it's rare we need to prescribe people opiates or stronger prescription medication to help with discomfort. Some people only have discomfort for a day or two. Some people it takes a couple of weeks. Everybody's different. However, if you're still having pain between 2 to 4 weeks after the procedure, we want you to be in touch with us to make sure there aren't any ongoing issues we can help you with. Usually this can be dealt with additional anti-inflammatory medications. There is one rare complication of the procedure related to pain where under 1 out of 100 men can get chronic scrotal pain starting either at the site of the procedure, in the scrotum, testicle, or groin, brought on by having this procedure. This is important for you to bring to our attention if you're still having pain more than 2 to 4 weeks after the procedure, so we can try to prevent you from going on to having any issues. Finally, one of the most important things to understand about having a vasectomy is it is a procedure that is not immediately effective at preventing a pregnancy. It takes somewhere between 6 to 12 weeks in most men to ejaculate all of the remaining sperm that are in the system downstream of where the procedure was done. And it is possible to still get a pregnancy after the procedure if you don't follow some crucial instructions. We are going to advise you to continue using birth control after the surgery until we have you perform a semen analysis test, and that comes back showing there's no evidence of any remaining sperm. In most people, this takes between 6 to 12 weeks and somewhere around 10 to 20 ejaculations to clear out all the remaining sperm. We do this test either through our labs at Beth Israel Deaconess, where you can provide a sample and drop it off in the lab 6 to 12 weeks post-procedure. We also work with a company called Fellow that can do this through the mail, where you FedEx the results back to them. That costs $149 out of pocket if you go with the Fellow test. Most testing done through our Beth Israel lab is covered by insurance. It's crucial that you keep using birth control till we get that negative test, as this is where most pregnancies after vasectomy occur. Once we get a negative sperm test back on you, the chance of becoming fertile again after that is somewhere between 1 in 1,000 and 1 in 10,000. So other than abstinence, once the procedure has been deemed a success with that negative test, this is the most effective form of birth control we have. There is a 1 out of 100 chance that you will never clear the sperm after the procedure, suggesting the vasectomy failed, either due to a technical error or the ends of the vas growing back together. This is why it's crucial that you do the post-vasectomy sperm test. If we find that the initial procedure failed, we would repeat it under anesthesia, and usually that procedure will be successful. Some other comments and common questions we get are, does this change the amount you ejaculate? The answer is in most men, no, because sperm only make up about 10% of the ejaculate. And the second question we often get is, when can you go back to sexual activity? I would say most people are able to go back to sexual activity within a week or so of the procedure once they feel up to it. Please feel free to contact us at 617-667-3739 if you're interested in further discussing the procedure or considering having the procedure with us, and we wish you the best of luck.